going to lose out on this are those of the most vulnerable. They're planning on taking away mass health and dental health care access to this segment of the population. They, from now on, are considering providing only preventative care, meaning allowing you to get your teeth cleaned twice a year, or emergency care, meaning having your tooth extracted. Think about it. If it's a front tooth, if this is your mother, your brother, your father, your sister, your friend, and it's a front tooth, and this tooth can be saved, and firstly, you have trouble finding a place to even treat this tooth, and when you find a place that are willing to treat you, they're telling you that this tooth can only be extracted. Think about the psychosocial impact of such a traumatic event. Think about not being able to even find a dentist who's willing to see you. Think about finally finding a dentist who's willing to see you, and he's telling you, you know what, I can't do anything for you. I can't fill that filling for you. I can't do anything but clean your teeth. In medicine, we have a terminology for this. It's called supervised neglect. We as professionals will supervise and watch your oral health fall apart and tell you that there's really nothing we can do. And the reason we're going to have to give you is because our state is having a budget crisis. Do you feel that that is a reasonable excuse for us to not cover our community, our population, when they need this most?
Is this, if they didn't do this, I could come to you and you could save my tooth?
Absolutely. For the past couple of years, the Massachusetts Dental Society, along with many, many dental activists, have been trying to recruit more doctors, dentists, to come in and accept Masshealth. The reimbursement for Masshealth is usually about 50 to 60% lower than what standard reimbursement is. But for the goodwill of a lot of the doctors out there, they're willing to take a hit in terms of their overhead costs and see this population. It's a way to give back to the community. We are very, very privileged as doctors to have been able to attend the best universities, especially in Massachusetts, and be able to be trained through the population that we serve. It's time for us as doctors to give back. But the state, by cutting away Masshealth, are essentially telling those doctors that are willing to give back that, you know what, you can't give back. You're going to have to watch your patients suffer. And I just don't think that's right.
What are you doing? Do you have any of the people on board that can have some clout that can help you?
I'm fortunate enough to be a member of the Quincy Health, Wellness, and Beauty League.
You are?
I am.
Yes.
I'm a member. I serve as an advisor. I've promoted this message, this threat that our community is facing to our board. And we're actively trying to provide articles to the newspapers.
Who's on the board? Is the board as impressive as
the board
as
is very the board is very, very impressive. We are basically a group of different healthcare organizations that are in the South Shore. Some of the members are, like, for example, the South Shore Hospital, the Quincy Medical Center, Harvard Vanguard, Blue Cross Blue Shield. And together we try to advise the city and provide initiatives to improve the health of the city. But we don't want to just be focusing, my focus at least has never been just Quincy. Although Quincy is a very significant representative of our state, but my focus is basically...
It's very diversified.
It is very diversified.
It's a city within the city.
It is a city within, and my goal is to basically, through our organization and through the Massachusetts Dental Society, provide our states, provide our citizens, provide our lawmakers with the information they need to make life-critical decisions for our citizens.
What about the people who are part of Masshealth who will lose out on this? Can they do anything? Have them being advocates?
Every time we have, I speak to one of my patients that have Masshealth, the first thing I urge them is, there's a good chance they're going to be canceling your insurance. We need to take care of your health first. I'm your doctor, I'm going to take care of your health first. And in the meantime, if it's possible, please make your legislature aware, make your representatives aware that by taking away Masshealth, we're not just taking away oral health, we are compromising your overall health. We're compromising your health, your family's health. We're compromising your children's health.
So people watching, viewing,
Yes.
who should they call? Who should they write to?
They need to call their representatives.
Okay.
They need to call their representatives. They need to call them, and they
What
need
about
to tell them.
Governor Patrick's? Is he the one who's doing this?
Unfortunately, it is. He is the one who had proposed cutting Masshealth Dental care. He is the one proposing to limit it to emergency care only and cleaning.
That will cost a fortune, because if they'll go to an emergency room, won't they? And that will be, they'll see them, but it won't cost them a lot more money?
I had the honor of working for the Brigham and Women's Hospital emergency room. I used to take call for them. I also took call for Harvard Vanguard for a period of time.
What an impressive resume.
Thank you. I'll tell you one thing. When a patient comes into the emergency room at Brigham and Women's Hospital, one of the best hospitals in the world, we're fortunate to have some dentists on staff. But we can't provide you with the necessary treatment you need. There's no continuation of care. What we can only provide you is emergency care. And that doesn't mean taking out a tooth that maybe needs to be taken out. That means giving you some antibiotics and sending you home. But there's something called antibiotic resistance. If you're a patient and you can't get continuation of care and you keep getting the same infections over and over again, antibiotics, sooner or later, the same ones do not work anymore.
Your body's immune to them.
Your body's, picture this, you're in an emergency room with somebody who had a traumatic accident, you have somebody who is in some kind of respiratory distress. We're talking about some serious medical conditions, and you're there with a toothache. Your pain can easily exceed the pain of all the other patients that are in the emergency room, but at the same time, we're also dealing with other patients with serious, life-threatening, acute situations. The emergency room of our hospitals, Brigham, Mass General, Quincy Medical Center, South Shore Hospital, these are not places for patients to go to for dental care. They were never meant to be designed for that. By cutting